Infectious respiratory germs can make us sick when they get inside our nose, mouth, throat, or lungs. Although we say these germs cause respiratory diseases, sometimes the initial infection can lead to symptoms that are felt in other parts of the body, for example, affecting our brain or heart health, or even passing to a fetus during pregnancy. What makes them infectious is that these germs are transmitted between people. So while there are other respiratory diseases that are not infectious, like asthma, emphysema, lung cancer, and cystic fibrosis, we're going to focus on the infectious respiratory diseases that can spread from person to person when we breathe in germs, because these are the diseases that we can help protect people from by ensuring we have good indoor air quality. Different germs cause different infectious respiratory diseases, and there are a lot of types out there. Some of these germs are bacteria, and some are viruses. Bacteria are tiny living things that can reproduce on their own. Thankfully, most bacteria are harmless, and some even live within us and do helpful things like digesting food or producing nutrients. But there are some bacteria that cause diseases, and these are the ones we want to watch out for. Some of the respiratory diseases caused by bacteria are pertussis, also called whooping cough, Legionnaire's disease, tuberculosis, strep throat, and some types of pneumonia. Some bacteria that cause respiratory diseases grow outside our bodies. For example, the bacteria that causes Legionnaire's disease can grow in our building water systems and cooling towers and air conditioners. If the mechanical systems cause the bacteria to get into the air, then people can breathe in the bacteria and get sick. However, most infectious bacteria live and grow within our bodies, and the main way they are transmitted is between people. Viruses are quite different from bacteria. Most viruses are not harmless and do cause disease. Viruses cannot survive on their own. Instead, they must first attach themselves to cells and then sneak through the wall of a cell to get inside. Once a virus has infected a cell, it can change the cell so that instead of doing its regular job, the infected cell will make more and more of the virus. This process is known as reproduction. Eventually, the cell can get so full of a virus that it bursts open, releasing the many new copies of the virus into your body. The released viruses can go on to infect other cells. Some of the respiratory diseases caused by viruses are COVID-19, measles, mumps and rubella, respiratory syncytial virus, more often called RSV, chickenpox, and the common cold and flu. Some fairly general symptoms of infectious respiratory diseases are coughing, fever, runny noses, sore throats, headaches, or just a general achy feeling. Some of these diseases have very distinct symptoms, such as the itchy spots from chickenpox. And of course, some diseases are much more serious than others. However, because we're all different, any two people infected with the same disease can experience very different symptoms and outcomes. One person could have a severe case, while another person could have a mild or even asymptomatic case, meaning they don't show any symptoms at all. Consider the flu or COVID-19. Sometimes being infected will lead to a few days where you don't feel great, but can still manage everyday tasks in your home. Other times, it'll knock you out for a week, making it hard to even get out of bed. And in very serious cases, it can lead to pneumonia, or in the worst cases, death. With COVID-19, we are also finding that some people end up suffering from what's called long COVID, which can affect them for many months or even years and make it difficult to function as normal. Often the people who deal with the worst outcomes are those whose immune systems are not as strong because they're pregnant or already suffer from some other diseases, they're really young and haven't had time to build their immune system, or they're older and their immune system is starting to weaken.